Hello everyone, in this video we will look at the difference between a testicular torsion and an epididymo-Orchitis. So in testicular torsion there is a twisting of the spermatic cord which results in blockage of the blood supply, whereas in an epididymo-Orchitis there is infection and inflammation of the epididymis as well as the testis. The age in which we see testicular torsion is adolescent, whereas epididymo-Orchitis is usually seen in sexually active adults or elderly men. Onset is sudden and severe in testicular torsion, whereas epididymo-Orchitis occurs gradually and can take hours to days to develop. Pain is severe and constant in torsion. It is progressive and aching type of pain in epididymo-Orchitis. Usually the patient gives history of some exercise or traveling, or it can happen during sleep or after a minor trauma, whereas in epididymo-Orchitis patient will give you a history of urinary infection, STDs, catheterization using prosthetics or some other material. Fever is usually absent in the testicular torsion and it is common in epididymo-Orchitis. Patient also has symptoms related to the urinary tract such as dysuria, increased frequency as well as urgency. Nausea, vomiting is common in testicular torsion, whereas it is absent in epididymo-Orchitis. Scrotal swelling is early due to ischemia, whereas scrotal swelling is a late finding in epididymo-Orchitis. The testicle which on the affected site is lying horizontal and a little high as compared to the normal site, whereas in epididymo-Orchitis both the testicles are on the same position, whereas they might be slightly enlarged. There is diffuse testicular tenderness in testicular torsion. In epididymo-Orchitis, initially it is tender at the epididymal site, otherwise later the entire testis becomes tender. Prehn sign, that is pain on relief of pain on elevating the scrotum, is absent in testicular torsion, whereas it gives relief of pain in epididymo-Orchitis. So Prehn sign is positive in epididymo-Orchitis. Cremasteric reflex is absent in torsion and present in epididymo-Orchitis. Skin changes are present in both the conditions and the scrotum will appear swollen, tender, warm and eczematous. In Doppler, there is absent or reduced blood flow in torsion and it is increased blood flow in epididymo-Orchitis. Urine examination may show signs of infection. In epididymo-Orchitis, the treatment option for torsion are surgical exploration, detorsion and doing an orchidopexy. In Orchitis, we are going to give antibiotics, analgesics to the patient, scrotal support and rest. So torsion is a surgical emergency and it has good outcomes if the patient is operated within 6 hours, whereas epididymo-Orchitis is an medical emergency and not a surgical emergency. Complications that occur in testicular torsion are infraction, gangrene, infertility, whereas an orchitis may result in abscess formation, chronic pain and rarely result in infertility. So one important point is that in a testicular torsion, there should not be no delay made in the treatment or it can result in grave complication in the patient.